So first we're gonna listen to heart sounds, and you can use the acronym all patients take medicine to remember where they are. So your first one is going to be your atrial valve. So it's going to be in your second and third intercostal space. And then you just want to listen for a lub-dub sound. And then you're going to go to your left side, and you're going to go in the same space, and you're going to listen for lub-dub again. And then you're going to go down about the fifth intercostal space on the side of the sternum, and you're going to listen for lub-dub again. And you're still on the left side, you're going to be over about mid-clavicle, and you're going to listen for lub-dub again. And you want to make sure that you don't hear any low-pitched sounds or any murmurs in the heart. So next is breath sounds, and you listen in the right and the left lung. In the right lung there's an upper, a middle, and a lower portion, and then the left lung is just upper and lower portion. And you want to listen in the front. And the back. Take a deep breath. Take a deep breath. And you're gonna listen to the back as well. Take a deep breath. And another one. And another one. And another one. And here you're listening for any abnormal sounds like wheezing, crackling, if they have a shortness of breath, and like wetness. Now we're gonna listen to abdominal sounds, and you're gonna listen to the 4 quadrants, so the upper right, upper left, and lower right. And here you wanna hear like a gurgling like sound, kind of like a growling sound. If you don't hear a sound or it's kind of abnormal, then it's probably not right. So first we're gonna start in your upper right, your upper left, your lower left, and your lower right. So the first cervical special test I'm going to do is the brachial plexus traction test, or the shoulder depression test. So realistically I'd be behind the patient, but she's on this table, so it's okay. So we're going to say her right side's the affected side. So you're going to place your right hand on the shoulder and the left hand on the head, and you're just going to push away, create tension. And a positive sign would be a reproduction of symptoms like pain down the arm, and it helps rule in a brachial plexus injury. This is the shoulder abduction test, or the nerve root compression test, and this is an active test. So you're going to have the patient, we'll say her right side's affected, so you're going to have the patient put your hand on top of your head, and a positive sign is if symptoms are relieved, and this helps indicate a nerve root compression. The next test is the Valsalva maneuver. So patient will be sitting, and you're gonna have them make a fist like this with a little hole in it, and put it to your mouth, and instruct the patient to blow in while buried down on the table. So go ahead and blow in and push down the table, like just with your body. Oh. This is positive if they are their symptoms are reproduced, and it is for a nerve root compression or disc pathology. Okay, the next test is the Sperling test. So you're going to, the first one that you can do is just provide axial compression to the head. But if they have no pain with that, then you can lateral bend them, and you can do it again. And you want to bend them away from the side of pain. A positive sign is they have radicular symptoms down their arm, and this help indicates nerve root pathology. This is the brachial plexus neuropathy test. So go ahead and make fists like this. Don't let me push down. Don't let me push up. Don't let me push in. Don't let me push out. Go like this with your fingers. Go like this. Don't let me push them in. Ah! And then put your arm out and push up against it. And put this arm out and push up against it. And this is positive sign if they're unable to do it, or they have like numbness and tingling, and this helps with brachial plexus injury. Next test is Tunnel sign, which I know that you hate, Professor Wayman, but you're just going to be like tap, tap, tap around the brachial plexus and some of the cervical vertebrae. And a positive sign would be reproduction of symptoms or pain down the arm, and this indicates brachial plexus injury. This is the active upper limb tension test, so the patient's gonna be doing this actively. To test your ulnar nerve, you're gonna have the patient reach behind their head to their opposite scapula, and then to test the median nerve, you'll want to have the patient externally rotate and horizontally abduct. And a positive sign would be a reproduction of symptoms, and this helps indicate a brachial plexus. This is the passive upper limb tension test, and you wouldn't do this if the active had pain, but the first one you'll test is your median nerve, so you want to extend the elbow, and then some slight abduction in the shoulder. You want to have your wrists and your fingers extended, and then you're going to have radial deviation. Your next one would be your radial nerve, and it's the same thing, your elbow extended, slight abduction in the shoulder, but you want to flex your fingers and your wrist, and you want ulnar deviation with this one. And then your last one is testing the ulnar nerve, so you want your elbow flexed, still some shoulder abduction, you want your wrist and fingers extended, and then you want radial deviation again. A positive sign is pain or radicular symptoms down the arm, and this helps indicate a brachial plexus injury. So this is the cervical distraction test, so you want to find the base of the occiput, whatever it's called, and you're going to apply some cervical distraction, so you're just going to pull back, and that's about it. And this, you can slide back down if you want. This, a positive sign would be their symptoms are relieved because you're separating their vertebrae, and this indicates a nerve root compression. This is the vertebral artery test, so you're going to have the patient on their back on a table, supporting their neck, and you're just going to take them until about 30 degrees of extension. Can you slide down a little bit more? There you go. 30 degrees of extension, and keep your eyes open and look at their eyes, and you want to make sure they don't have any stagnus. You can slide back down. And a positive sign would be stagnus of the eyes, and this causes a referral for a vertebral artery occlusion. And the next test is the Atson's test, and so you're going to find the patient's radial pulse, and then you're going to bring them into shoulder extension, horizontal abduction, and then you're going to instruct them to look towards where you're standing. And a positive sign is if the radial pulse diminishes or goes away. This is for thoracic outlet syndrome. Also with that is the Allen's test. Same thing, you want to find their radial pulse, and then you're going to bring them into an L like this, and then you want the patient to look away from you and then hold their breath. And a positive sign would be if their pulse diminishes or goes away, and this is also for thoracic outlet syndrome. And then military brace, you're going to find the radial pulses on each hand, and you can do this one arm at a time. And you're going to bring your shoulders back, and then I want you to stand like you're at attention. And a positive sign is if their pulses diminish or goes away again. And this is the last test for thoracic outlet syndrome. This test is the cervical vertebral joint plate, so you're really just feeling around with all of their cervical vertebrae and kind of just feeling how they move. You want to feel around C3, C4, C5, C6. Just make sure that there's no problems, deformities, pain, stuff like that. You can also do this when they're on their stomach, and do the same thing, play with all of their vertebrae. You can slide down if you want. A positive sign is laxity or deformity or pain, like I said, and then this helps indicate if there's problems with the cervical vertebrae.